Imagine this for a second. You wake up, you sit up in bed, and you suddenly realize half the world has just gone totally silent. That is exactly what one patient on Reddit described, along with this crazy, disorienting pressure and the totally terrifying sensation that their own voice suddenly sounded literally like a kazoo. No warning at all, no obvious cause, just this immediate, drastic drop in hearing. I mean, it is a profoundly terrifying experience that just completely upends your reality in an instant.
And naturally, the very first thought that races through the mind of anyone going through this is my hearing gone forever? It's this paralyzing fear. Well, let's dive into this, because today this explainer is going to be your guide to finding some answers. We're going to navigate the medical realities, the treatments, and honestly, what it actually takes to survive the emotional roller coaster of recovery.
Welcome to our explainer on sudden silence, navigating sudden sensory neural hearing loss. We're going to break down the science of the inner ear and the very real-world fight to get your hearing back.
Section 1. The sudden silence. Waking up to quiet. So most patients first notice the symptoms right when they wake up. It's this sudden sensation of fullness, kind of like your ear desperately needs to pop, but it just won't. In medicine, this is strictly defined as sudden sensorineural hearing loss, or SSNHL. Basically, that means a documented drop of at least 30 decibels across 3 consecutive frequencies, all happening within a super tight 72-hour window. Now, while about 10 to 15% of these cases can be traced back to something specific, like a viral infection or maybe an autoimmune issue, the vast majority are what doctors call idiopathic, which is really just a fancy way of saying the cause is a total mystery.
Section 2. Diagnosing the damage, measuring the loss.
Look, when the world goes quiet like that, you really can't just wait around hoping it clears up like a bad head cold. You've got to act fast and get an audiogram. This test is crucial because it maps out exactly which frequencies you've lost and just how severe that loss is, whether it's mild or profound. And this isn't just for putting a name to the problem. This visual map directly dictates your entire treatment plan. It shows doctors exactly which nerve pathways are misfiring and struggling to get sound signals to your brain.
But here is where what you feel completely clashes with the clinical reality. Let's think back to that kazoo analogy from our Reddit patient. They felt this intense pressure and congestion, right? But when the ENT actually looks inside the eardrum is perfectly clear. It turns out inner ear nerve damage is tricky. It actually fools your brain into feeling like there's a physical fluid blockage in there. But in reality, the hardware is totally fine. It's the electrical wiring, the nerve itself, that's damaged and misfiring. Because of all that, the most absolute crucial point here is timing. You have a very specific and very critical window. From day 1, when symptoms start, to day 3, where that diagnostic threshold gets met, the clock is ticking loudly. Clinical guidelines heavily emphasize that the primary window for starting steroid treatments begins closing right around day 14. So yeah, it's definitely a terrifying race against the clock, but acting fast is the absolute best way to maximize your chances of getting that hearing back.
Section 3. The treatment ladder. Acting fast.
Okay, so to combat all that unseen inflammation, the medical community uses a tiered approach. They start with the least invasive stuff first. Step 1 is almost always a pretty heavy course of oral corticosteroids. Think like a prednisone pill taper. It's a systemic blast meant to just knock out the inflammation across the board. But if the pills fail, or if your medical history means you can't take high-dose oral steroids, we move on to step 2, which is intratympanic steroid injections. And yes, this is exactly what it sounds like. A doctor literally injects steroids directly through your eardrum to just bathe the inner ear in medication.
I know. Getting an injection straight through your eardrum sounds absolutely terrifying, so let's be super realistic about what to expect here. They do use a local anesthetic to numb the area, so it shouldn't be super painful, but you are going to have some side effects. Patients often get a brief bout of dizziness or vertigo, maybe a little ear pain, and sometimes a really weird sensation of a numb tongue, which is, definitely not what you'd expect when you're getting a shot in your ear. Afterwards, you literally have to lie perfectly flat for 15 to 20 minutes just so the medication can soak deep into the cochlea. It's a bit unsettling for sure, but those side effects are usually super brief and the localized treatment is just highly effective.
Section 4. Salvage therapy in HBOT. Exploring every option.
But what if those initial treatments just aren't doing the trick? Well, that brings us to salvage therapy, basically exploring every single remaining option to save the hearing. Let's compare the two heavy hitters in this phase. On one hand, we've got the direct delivery of those intratympanic steroid injections we just talked about, targeting the cochlea. On the other hand, we have hyperbaric oxygen therapy, or HBOT. With HBOT, you're sitting in a pressurized chamber for about 90 minutes a day.
Why? Well, the cochlea is an incredibly oxygen-hungry organ, and it actually has very minimal direct blood supply. The whole idea here is to flood the inner ear fluids with oxygen to heal that hypoxia and stop any further nerve death.
Now, if you're wondering if sitting inside a pressurized tank every day is really worth all the effort, take a look at the number 5.3. In medical statistics, this is known as the number needed to treat. Basically, it means that for roughly every 5 people treated with early oxygen therapy, 1 person will experience a significant improvement in their prognosis directly because of it. For a condition that comes with so many scary unknowns, those are incredibly promising odds.
Section 5. The tinnitus torment. The unseen struggle.
You know, often the absolute worst part of this whole ordeal isn't even the silence. It's the noise that fills it. Check out this quote from a patient navigating the aftermath. "If you're gonna get better, it could take months, possibly a year. It feels hopeless most of the time." That emotional exhaustion is just profound. You're dealing with this really slow, totally unpredictable recovery timeline, all while a constant whooshing, screaming, or ringing noise is playing in your head 24/7. So if you're going through this and feeling that way, it is incredibly validating to know that you are absolutely not alone.
So how do you actually survive that daily torment? Actionable strategies are totally key here. Things like sound therapies, just using white noise generators, can really help mask the ringing and finally give your brain a break. Cognitive behavioral therapy, or CBT, is also highly recommended. Why? Because high anxiety literally makes the ringing seem louder to your brain. It's this vicious cycle. Managing stress through deep breathing and, of course, avoiding loud noises, well, those aren't just cute wellness tips. They are essential neurological tools to help you take back control.
Section 6. Finding your new normal. Looking forward.
Eventually, patients do move out of that acute crisis phase and begin finding their new normal. And if there is literally one thing you take away from this explainer today, let it be this: recovery is not a straight line. Surprisingly, up to half of patients recover some hearing without any treatment at all, usually in those first couple of weeks. Plus, over time, your brain performs this incredible feat of neuroplasticity, literally rewiring itself to adapt to its new sensory inputs. It's kind of amazing.
And let's look at this incredibly hopeful statistic too. If you have mild to severe hearing loss, and you fall into what doctors call the steroid effective zone, and you get treated quickly, you have an over 75 to 80% chance of recovery. Those are fantastic odds, but again, only if you act fast and really advocate for your own medical care.
But hey, even if recovery is incomplete, the journey definitely doesn't end there. You'll have follow-up audiograms at the 6-month mark to track any changes. There's also some seriously amazing technology waiting for you out there, from advanced hearing aids all the way to cochlear implants. And honestly, perhaps most importantly, there are these incredibly vibrant support groups like the Hearing Loss Association or the RNID. You absolutely do not have to navigate a new mono-hearing world all by yourself.
Which leaves us with a final thought to ponder today. Sudden sensory neural hearing loss is, at its core, an invisible trauma. You can't see the damaged nerve, and you definitely can't hear the deafening tinnitus the patient is experiencing every single second. So, how can you best support someone who's navigating this? Well, it starts with immense patience, proactive medical care, and just deep empathy. The silence might come on suddenly, but the journey to healing doesn't have to be walked alone. Who in your life might be fighting an invisible battle that you can't even hear? Thank you so much for joining me. Keep advocating for yourselves, and we'll see you on the next explainer.